Diabetes mellitus by Natalie Capobianco. So what is diabetes mellitus? Well, diabetes mellitus is a condition where the pancreas no longer produces enough insulin, or the cells stop responding to the insulin that is produced, so the glucose in the blood can't be absorbed into the cells in the body. This first diagram shows how type 1 diabetes affects the pancreas and how there's no insulin produced at all. And the second diagram shows the difference in type 2 diabetes, how some insulin is produced but the body may reject it, or there's not enough being produced. There are three different types of diabetes, and the first one is type 1. Type 1 diabetes is called insulin-dependent diabetes and is often started during childhood. Therefore, it can also be referred to as juvenile diabetes. This can happen when the body attacks the pancreas and cannot produce insulin, and it can also be caused by a parent having type 1 diabetes also, so it can also be genetic. Someone with type 1 diabetes is also at a higher risk of having heart disease or stroke, along with other health risks like the nerves in their feet being a lot more sensitive than the nerves in their other body, so they have to take extra specific care of their feet because it can result in the loss of toes or a foot in general. Someone who has type 1 diabetes needs to inject insulin into their body, and this can be done one of four ways. The first way is through needles, where the insulin comes in little glass bottles and they take the needle and they fill it to the set amount of insulin they need. The second way is through an insulin pen, where the insulin is already inside the pen and there's an indicator, and they set the indicator to the amount of insulin that they need. The third way is through an air injector, which uses pressurized air to inject the insulin into their leg. The fourth way is through a pump that connects to a catheter inside the stomach. Someone with type 1 diabetes also needs to have significant lifestyle changes, which includes exercising more often, taking extra care of your feet, checking their blood sugar very regularly before eating, after eating, making sure that they're keeping up the amount of insulin they need. The second type of diabetes is type 2 diabetes, which can also be called adult onset or insulin-dependent diabetes. With the increasing of obesity in children, children can also develop type 2 diabetes. Again, someone with type 2 diabetes can also have a greater risk of heart disease or stroke. In type 2 diabetes, the body can produce some insulin, but is often either not enough or the person is insulin resistant, which means that the body doesn't recognize the insulin that is being produced, therefore it doesn't allow it to continue producing that insulin. Someone who is 20% over their intended body weight, which means obesity, is at a higher risk of developing type 2 diabetes. To control type 2 diabetes, you often need to have weight management classes, nutrition classes, watch what you're eating, and daily exercise is needed. Doctors may also perform an A1C test, which is where they will check your blood sugar every 3 months and see how it fluctuates and give you planning on what to do next after that happens. There are a lot of symptoms that go into type 1 and type 2 diabetes. In type 1, there's increased urination and increased thirst. There's also bedwetting in children that have never wet the bed before. There's also an extreme feeling of hunger where you're hungry all the time and maybe you can feel full but you still want to keep eating. Unintended weight loss is also a big one. Irritability and mood changes. Someone who is becoming very moody, who's not usually moody, is also a good sign. And blurred vision can also mean that your blood sugar is too high or too low, so you should get that checked out. The symptoms for type 2 diabetes are the same as type 1, minus the bedwetting. You can also have slow healing sores and fatigue, and you can also be prone to getting infections rather quickly when you have type 2 diabetes. And you can also notice areas of darkened skin on your legs, thighs, stomach, hands, arms, face, pretty much all over your body. If there's a darkened area, you should probably get it checked out. In type 3, the third type of diabetes is gestational, and this diabetes is triggered by pregnancy. Usually between the middle and late pregnancy, so the second and third trimester of pregnancy, a doctor may perform a test to check the blood sugar, and you may find out that you have gestational diabetes. When you find out that you're pregnant, a doctor will go over with you the precautions of gestational diabetes and how it can affect you. 2 to 10% of pregnancies in the world end up with the woman having gestational diabetes. When you have gestational diabetes, after the baby is born, the mother has a greater risk of developing type 2 diabetes later in life, and this can happen weeks after pregnancy, days after pregnancy, or even years after a pregnancy. 10% of women who have gestational diabetes will develop type 2 diabetes later in their life, and the risks of the woman having type 2 diabetes are actually greater for the baby, which the baby can be born with type 1 diabetes, or have a greater risk of having gestational diabetes when they're older and have a baby if they are born a girl. And they can also have increased weight. What can you do? Well, there is no cure yet, but you can help by donating to the JDRF, the Diabetes Research